Hello everyone, welcome to another NP Academy lecture. Today we will talk about role of dexamethasone in the treatment of COVID-19. So we will talk about dexamethasone in the treatment of COVID-19. Basically this was a clinical trial and the name of the clinical trial was recovery trial. Recovery stands for randomized evaluation of COVID-19 therapy trial. This trial was conducted in England and this was conducted by one of the best group in the world. They are in Oxford University in UK. And the earlier result was published in one of the best journal in medicine called New England Journal of Medicine. This work came in the July of this year 2020. This was rather a very complex trial. They started out with 11,303 patients, and these patients were hospitalized in above over 176 hospitals all across the UK for COVID-19. And they not only looked at the dexamethasone, so they definitely looked at the dexamethasone. Not only this, they also looked at the other drugs such as hydroxychloroquine, azithromycin, plasma antibody, as well as some anti-HIV medicine. However, the result of dexamethasone was so striking that they went ahead and shared the data to the world so that they can use the information in the management of COVID-19. So we will be discussing about the dexamethasone study today. So for this work, they selected 6,425 patients. And the clinical feature for these patients were the mean age of these patients were 66 years. Roughly approximately 56% of the patient had one major comorbidity. Approximately 24% of the patient had diabetes. 27% of the patient had heart disease. 16% of the patient were intubated. 60% of the patient were on oxygen, and 24% of the patient were not on oxygen. So as you can see, they were very diverse group of the patient. And so out of these 6,425 patients, they divided these patients into two groups. In one group, they took 4,321 patients and they treated them with something called usual care. That means these patients were treated by the doctor the way doctor thought that's useful for the patient, whatever the doctor thought that is the best for the patient at that time. Then they had another group. In this group, they had 2,104 patients, and these group also received the usual care. In addition, they also received dexamethasone. So the difference between this group and this group is a dexamethasone. So going forward, we will call this group as a plus dex group, and this group will say minus dex group. And the dosing for the dexamethasone was this. The Methasone. This group, they received 6 milligram of dexamethasone, either PO or IV, once a day for 10 days. And they had a different outcome. They looked at the outcome. One of the main outcome was they looked at the change in mortality, change in death rate at 28 days. So change in mortality in the first 28 days after the treatment. First 28 days. And what they find is this, that among intubated patients who were intubated, and when they treated these patients with the dexamethasone plus dex, they found the death rate within the first 28 days of treatment, the death rate was 29.3%. On the other hand, the group who did not receive the dexamethasone, the death rate among them was 41.4%. So the difference here is 12.1% less death in the patient who received dexamethasone. This is a very, very striking finding, that for every 100 patients who were treated, who were intubated and who were treated with the dexamethasone, the 12 lives were saved. So 12% less people died if you treat with the dexamethasone compared to if you don't give the dexamethasone. And that's a wonderful finding, that you are basically saving 12 lives out of every 100 lives that you treat with dexamethasone. And as of now, no drug has actually shown any effects on mortality with COVID-19 patient. Dexamethasone is the only drug so far that has shown that it decreases the mortality in intubated patient by 12%. The remdesivir and all, it does shorten the recovery time. So if you have a COVID-19, if you get the remdesivir, you get better rather faster, but that does not affect the mortality rate. It's only the dexamethasone. That's very, very exciting. Okay, what happened to the patient who were not intubated but they were on oxygen? So on oxygen. In this group, when the group who received the dexamethasone plus dexamethasone, their death rate was 23.3%. However, the group who did not receive the dex, their death rate in this group was 26.2%. So the difference here is 2.9% less people died when you give them the dexamethasone. So it's not as striking as the one who were intubated, where you have a 12.1%, but still you are saving 3 people out of every 100 who were on the oxygen if you give them dexamethasone. That's really, really great finding. Okay, what happened to the people who were not on oxygen? So the people who were in the hospital with COVID, but they did not need any oxygen, no oxygen. These group, when they received the dexamethasone, the death rate among them was 17.8%. However, the group who did not receive the dexamethasone, the death rate was actually less, 14%. So here the change is basically 3.8% more death among the people who received the dexamethasone. The people who were not on the oxygen, if you give them dexamethasone, that makes actually things worse, because 3.8% more people died. So that's very interesting. Well, that was one of the outcome. They looked on another outcome. The another outcome was how many people get discharged home alive in the first 28 days after the treatment. So discharge alive within the first 28 days. And again, they divided this result in 3 different groups. So the group who were intubated, the group who received the dexamethasone, in this group roughly like 33% of the patient were discharged home alive within the first 28 days who were intubated who got the dexamethasone. On the other hand, the group who did not get the dexamethasone, the discharge rate were 23.3%. So difference here is 9.7% more people went home alive who were initially intubated if you give them dexamethasone. So this is another one, is a very striking finding that you save at least 10 lives out of every 100 life. Okay. On the people who were on the oxygen, what happened to them? The one who received the dexamethasone, the number of patients who went home was 72%. However, the group who does not receive the dexamethasone, the discharge home was 67.4%. So still a benefit of 4.6%. More people went home if you treat them with dexamethasone. Not as great as intubated patient, but it definitely help. Okay, what happened to the people who were not on oxygen? So no oxygen. In this group, the group who received the dexamethasone plus dex, the discharge home in first 28 days were 76.8%. However, the one who did not receive the dexamethasone, the discharge home were 80.4%. So difference here is actually 3.6% less people went home alive if you treat them with the steroid. So 3.6% less people went home who were the patients who were not on oxygen if you give them steroid. So not giving the steroid were more useful for the people who were not on the oxygen. That's very, very striking finding. Okay, let's talk a little bit more about the steroid. So this study was done using the dexamethasone, as I said, dexamethasone 6 milligram once a day. In a situation where you do not have access to dexamethasone, then you can use other steroid in the equivalent dose. So the 6 milligram dexamethasone, the equivalent will be prednisone 40 milligram, solumedrol 32 milligram, or hydrocortisone 160 milligram. However, it is recommended to use dexamethasone because this was the drug who was used in the trial and showed the benefit. You can use this drug only if you absolutely cannot find the dexamethasone. Okay, well, how does steroid work? How steroid saves life in the COVID-19 patient? And theory is this. Say for example, if you get the COVID-19 infection and start with the day 1, and then you have a day 5, and then you have this day 10. Early in the disease process, you have a high viral load. Viral loads are high mainly because these viruses are replicating in a high rate and you are very contagious. Later in the disease process, body respond to this high viral load by activating systemic inflammation. So you have a systemic inflammation. And it is this systemic inflammation actually this causes the lung injury. And this lung injury actually causes shortness of breath, and sometimes that's what make you to use the cause the hypoxia, and sometimes you need the intubator. So your steroid is one of the most broad spectrum anti-inflammatory drug. That's what a steroid does. A steroid is your anti-inflammatory. A steroid actually suppresses this systemic inflammation. That's why you don't get this lung injury and none of these happen. So that's how a steroid saves life. One of the another finding that came out of this trial is that the steroids were more effective on the patient who had the symptom for more than 7 days. And this makes sense because it's a systemic inflammation start later in the disease process. So the people who had a symptom for less than 7 days, steroid was not very helpful. So here we have it, a trial that was conducted by one of the best group in the world. The data was published in one of the best journal in the world, New England Journal of Medicine. And what they say is that if you are intubated because of COVID-19, or if you are on oxygen, on oxygen, then 6 milligram dexamethasone, either PO or IV, actually saves lives. It has a great outcome, so definitely use that. On the other hand, if you have a COVID-19 and you are not on oxygen, then any steroid including dexamethasone is not a good idea. Do not take a steroid, because if there's anything it harm you, it will not help you. So this is all about it for today. I hope you find it useful. Thank you very much, and I will see you next time.